drugs whose prototype is the drug alendronate. They stabilize the hydroxyapatite bone structure. They actually induce osteoblasts to secrete inhibitors of osteoclasts, and that causes decreased bone resorption and certainly decreased progression of osteoporosis. Alendronate is the prototype of the bisphosphonates, but it's easy to recognize the other members because this is a common family name, which is dronate. Alendronate, pamidronate, etidronate, risedronate are other examples. These drugs are first-line therapy for postmenopausal osteoporosis, but they're also used in Paget disease. Can you recognize this patient? Patients with Paget disease experience bone pain, perhaps deformity, perhaps their head is getting larger and their Sunday hat doesn't fit anymore, or increased levels of alkaline phosphatase can also be a marker for Paget disease. Bisphosphonates can be useful. One of the major side effects to be aware of is GI distress and possible esophageal ulcers. It's why we recommend that patients, when they take their bisphosphonate, that they remain upright for at least 30 minutes after their dose. A more serious, but certainly more rare side effect is osteonecrosis of the jaw, so regular dental exams certainly are recommended for patients taking these medications. The drug teriparatide is a recombinant PTH analog. In fact, it's the only drug we have today that can stimulate new bone formation, and it's certainly useful today for osteoporosis. Now that we've finished these last few chapters, let's do 2 practice questions together. Here's the first one. Try it on your own, and then we will discuss. Forrest is diagnosed with a tumor in his appendix. He has recently experienced some facial flushing. Labs show elevated urine levels of 5-HIAA. When he is started on appropriate therapy for this condition, he should be monitored for what side effect. Do you recognize what problem Forrest is experiencing? With the tumor in his appendix, facial flushing, and high levels of 5-HIAA, it sounds like carcinoid syndrome, where octreotide is a very useful drug. Patients who take octreotide need to be monitored for possible gallstones. Choice B. Here's question number 2. Try the question on your own, pause the video, and then we will discuss. Primary therapy for osteoporosis prevention involves a drug that is also used in Paget's disease. Immediately after taking this medication, patients should remember what advice. Of course, the drugs that we're talking about are bisphosphonates. Very commonly, that's the drug alendronate. When you take these types of drugs, because they can cause esophageal irritation and possible esophageal ulcers, patients should drink a lot of water and stay upright for at least 30 minutes. So the correct answer here is choice C.